Welcome again. We want to talk about various breast issues that you should know about. So, when you know your breast very well, it is easier to notice something uh, when they change, or you notice when something changes. And though most changes are not signs of breast cancer or other serious health problems, but some do warrant a check with your doctor. So, here is what to know about breast tissue that you may notice. Number one is breast lumps. Anyway, try not to worry because most lumps are not cancers. You understand? Some of them are cysts, and other harmless causes are more common. And of course, when we're talking about breast tissues, and most cancers don't start with a noticeable lump. You might not see anything because we have various types of cancers. But do well to see your doctor to find out what is it whenever you have a problem with your breast. And this is especially important if you notice large lump in your armpit or if the bumpy area doesn't go away after 6 weeks. It is very, very important to take care. Then another thing is your breast color and texture changes. If the skin around your breast become dimpled, itchy, scaly, or red, you should see your doctor. And of course, they may just keep an eye on this or just order a biopsy, removing a small tissue, a small piece of tissue to make sure that everything is okay. You understand? It is better to know. Then, when we're talking about breast rash, you could have redness or irritation on your breast. You understand? Or a rash that is itchy, painful, scaly, or blistered. But if you see or feel any of these things, what should you do? You should see your doctor. It is very, very important. Don't just the rule of assumption when it comes to your health. No, it's a no-go area. There are some rashes that you will only get on your breast. You understand? And causes of these rashes may include maybe an abscess. It may be a mammary duct ectasia. That is when the milk duct beneath your nipple they get wider. It might be a mastitis, a breast tissue infection, which of course usually tied to breastfeeding. And of course, it might be nipple eczema, which we call dermatitis. And of course, when we're talking about that, a rash on your nipple can also be a sign of a couple of different things, of different types of breast cancer. One of them, which is rare, we call it Paget disease of the breast. And this one starts right there on the nipple. And what does it do? It spreads to the skin around it. And when it's spread, your doctor may call that area areola. And of course, the other inflammatory condition, inflammatory condition that we call breast cancer, this one will make your breast to be red. And when the breast is red, it becomes swollen and of course tender. And it happens when cancer cells block lymphatic vessels in your breast skin. No, there's no lymphatic drainage again. Then, of course, we want to talk about nipple discharge. When we're talking about nipple discharge, this includes any fluid that comes out of your nipple. Either it's bloody, either it's milky, it's just plain, it's yellow, green, brown, whatever. It can happen during pregnancy, and of course, it can be during breastfeeding. And you do know what? It can even continue up to 2 years after you stop nursing. This is all normal. So there's no cause for alarm. The hormonal changes associated with menopause can also do what? Cause some leakage in the breast. So anyone who has nipple discharge should see their doctor. I repeat, anyone with nipple discharge that you're not sure of should see their doctor. If the discharge is what? Bloody, if the discharge is coming just from one breast, if it is happening without you touching or squeezing the breast, you should see your doctor. If the discharge is accompanied with breast pain, redness, swollenness, or nipple changes, you should see your doctor. And of course, the cause could just be an infection. There's a sac with a sac filled with fluid we call a cyst that will just be there. It's an infection. Other lumps that are not cancerous, such as there's some names we call in medical terms, such as fibroadenomas or cancers. So nipple pain, of course, your nipple are sensitive and they can hurt for a lot of reasons, from tight clothing or poorly fitted bra to more serious reasons. And some skin condition, of course, such as skin conditions such as dermatitis, like um, contact dermatitis. I'm trying to remember another one. Eczema can also do what? Cause pain in your nipples. So, and of course, pregnancy or breastfeeding can also cause pain, can cause it too. So, for some nipples that are hot, some nipple that hot can be a sign of period that is coming, just normal, most of the time before during pregnancy, a period that is coming. It can be a sign of infection such as thrush or inflammation of the breast can also aggravate the nipple to make you have nipple pain. Then of course, all nipples may make you worry about breast cancer. But why it can be a sign of breast cancer, some nipple pain is hardly ever the main symptom of cancer. So because most people when they have nipple pain, they are scared. This is cancer. It's a sign of cancer or something. Cancer does not come cheap like that. Nipple changes every once in a while. You must see something different with your nipple today, see another thing tomorrow. Some people are born with inverted nipple, some have straight nipple, others develop, them later in life. Of course, if it is like that, you need to call your doctor to see him, let him take care of you. Your doctor may call them retracted. This can be normal part of aging, but it can happen when you are breastfeeding, or it may happen after you have had surgery on your breast. It can be a result of breast injury as well, soreness and tenderness in breast. But if you have period, that's always a possible cause. So, of soreness. So you should be able to see your doctor if there's any abnormality in your body. The breast soreness can start before or after your period. This is normal. This is normal because usually the pain will go away on its own. But get the pain checked out if it gets worse. And if it is in one of it is one in one area of your chest, or if it affect your daily routine such as working out or lifting your kids, things like that. And I want you to know, if you have armpit pain, and you are feeling pain, in your armpit, either to the right or the left, and you are not sure where it's coming from, you should see your doctor because it might be a sign of breast cancer. While it could be something more serious, at times it might be as simple as muscle strain or chest pain or something or swollen lymph, but at the same time, swollen lymph node caused by a viral infection, but at times it could also be a sign of breast cancer. So you have to see your doctor, whatever you are, and make sure you take care of yourself. If there are changes in your breast at a point in life, for example, your breast might get bigger when you have your period, there is no cause for alarm because it's part of it. Or when you are about to give birth, to deliver, or when you are pregnant after menopause, it's part of it. Whatever the case, see your doctor and see you in the next video.